Hello everybody, I am Roberto Ferrari from the University of Ferrara, and I'm here to tell you that to have elevated blood pressure is bad. It damages the heart, the brain and the kidney. And the problem is that you do not feel the level of pressure in the pipes of your body. For this reason, hypertension or high blood pressure is considered the silent killer. This is because there is too much salt in your meal. So please, my message to you is please reduce the salt in your meal. Cook with less salt. Remember, this is an S.O.S. Step down with your salt. It's very important for your health. Of course, this can be done, and Dr. Sajith K will tell you how to do it.
Hypertension is a chronic disease. Unless you address it properly, it will lead to cardiovascular issues like hypertrophy, which may subsequently lead to heart failure. Then it produces the chronic kidney disease, which subsequently leads to end-stage renal disease. Then similarly, it produces retinal changes. So all these issues could be prevented provided you treat hypertension properly. To treat hypertension, we should have 24-hour blood pressure control. For that, the treating physician should have the idea of PK/PD profile of each drug which is writing. So, in fact, short-acting drugs it should be given twice daily. See, there is a terminology called masked hypertension, where if you give a short-acting drugs, then it may produce issues on the long term, because inside the cabin of the physician the blood pressure measurement may be normal, but outside in the sense that in the evening time there may not be any availability of the drugs in the system, and subsequently the entire night heart might have been worked against the pressure gradient, which produces issues on long term. So to select a drug, we should have the PK/PD profile. If short-acting, it should be given twice daily to address the blood pressure control the entire day. Similarly, for lifestyle modification is very essential in controlling blood pressure. Then salt intake is very essential. We should reduce the salt intake, preferably 2 grams per day. Then considering the drugs available to treat as per the ESI 2021 guideline, we have a which means the RAS blockers, calcium channel blockers, diuretics, and even beta blockers are now considered as a first-line drug. In the recent means quite some time beta blockers were off the guideline. Now it has come back as a first-line drug, and it could be given at any stage of heart failure. Similarly, a new modality has been considering in the resistant hypertension, like renal denervation. Renal denervation is an effective procedure where you cannot entirely replace the drugs, but if you do properly renal denervation, you could reduce the pill burden. Like from 3-4 drugs, you could bring down the resistant hypertension treatment to 1 drug. So that all depends upon how you do the procedure. Like the more distally you denervate, then the more results you will have, and hence you could reduce the pill burden. Then for resistant hypertension, give RAS blockers plus calcium channel blockers and beta blockers is essentially diuretics for a mineralocorticoreceptor blocker should be added. Then it is very pertinent to have 24-hour blood pressure control to contain the complication due to hypertension in the long run.